Well, in 1967, Africa hosted the first heart transplant in the world in South Africa. It was an occasion that showed the potential of a continent that has often been its own biggest holdback. More than 50 years since then, millions of Africans now seek wellness in foreign countries. The journey to wellness has left African healthcare sector struggling to keep up with the rest of the world, and COVID-19 exposed the weaknesses of Africa's health system. So after months of being stuck with the same conditions they failed to improve, African leaders have grown wings again. With borders now open and the rest of the world accessible, sadly, hundreds of millions of other Africans have no choice than to cope with the conditions their leaders run away from. Welcome to Village Square Africa. I'm Sulaiman. You know, without a doubt, Africa has enough tourist attraction sites to boost its untapped healthcare sector. Like India, which hosts many African medical tourists every year, the continent has boundless potential to sell its medicine, tourism, and culture. Now, COVID-19 pandemic, although unwanted, is seen as an opportunity for African leaders to finally invest in the healthcare of their countries. And quite a lot needs to be done. The hospitals have been left abandoned again, and the health workers have been ignored once more. Lessons have not been learned, and the positives of the pandemic haven't been keyed into. Despite the pandemic killing many past and present African leaders, there's no developmental stride on the continent. Now, poorly funded African hospitals are still a far cry from providing adequate wellness for most patients. What many saw as a channel towards growth, although painful, has failed to yield any ease amid its devastation. Now, I'm now being joined by Dr. Victor Ngani, Group Medical Director, RFH Healthcare Kenya, and Dr. Peter Emoisi, Research Fellow, University of Aberdeen, Scotland. Gentlemen, good to have you both on VSA.
Thank you, Sulaiman.
Thank you.
So let me start with Dr. Ngani. Let's start by asking your take on the failure of African leaders to use the opportunity of COVID-19 to get committed to developing the healthcare sector.
Well, Sulaiman, isn't that the greatest tragedy of Africa as a continent? Because in March last year, we had a fantastic opportunity to rally our resources together, utilize the human resource that we have within this continent to build our health systems. Finally, we had something shining the spotlight into the health sector and telling us, invest here and make a difference for your countries. Unfortunately, the last year has gone by. We are now witnessing multiple surges in countries such as Kenya, for example. And unfortunately, it's catching us as flat-footed as we were when this pandemic broke out in 2019 and in Africa early last year. So we have not done as much as we could have as a continent. I think our leadership, to some degree, hasn't really learned the lessons that ought to have been learned, and there's been great disservice to the people of Africa as a result of this lack of, can I say, prioritization of healthcare.
Well, Dr. Emoisi, just like Dr. Ngani, so many other African experts have also said that the continent missed on a big opportunity to cash in on. What would you say is missing in this lesson that hasn't actually been learned by African leaders? At the moment, Nigeria's president is on medical holiday.
Thank you, Solomon, for having me. I won't say we've missed the lessons yet because we're still in the middle of the pandemic. But from 2020 till now, it is a little bit clear maybe we're not really learning what COVID-19 has placed in our hands and the opportunities it comes with. So I think we're still in the pandemic and there is still opportunity for us to learn. And basically, my own assessment on the pandemic is not a silver bullet approach, because when you look at a few countries in Africa, for instance, South Africa are actually doing very well when it comes to the pandemic response, notwithstanding that they have high fatality when it comes to COVID-19 related deaths. But even at that, when you look at the health structure in South Africa, when you look at the research, when you look at the level of expertise, you could tell that, of course, these guys are actually doing very well. When you go down to, I think, the northern part of Africa as well, Tunisia, Egypt, Morocco, and the rest, they're not as bad as the other part of the continent. But when you come down to the sub-Sahara, West Africa, then you could say, yes, of the truth, there's a big problem in this area. So it's not a problem that cut across all of the countries in Africa. But when you do a general pool of the issue, basically, you will say of it true, there are issues here and there. But I think as we get along, maybe some persons will sit tight to really learn the lessons of COVID-19 and how to kind of improve our healthcare infrastructure and human capacity development as well.
Dr. Victor, I recall once during the pandemic, there was a strike action by medical workers in Kenya because of lack of facilities to work with, especially PPEs. That also gave a sense of what the sector suffers from, in Kenya, in Nigeria, and a couple of other African countries. What has changed so far since then?
Well, Suleiman, I wish I could say that something has changed, something positive. But if I just pick it up from where Dr. Peter left it, you see, countries like South Africa, even before the pandemic, you'd notice that South Africa had invested quite heavily in the health sector. Compared to the average sub-Saharan African country, SA was doing much better. The same situation applied to a country like Egypt, and can we say the northern African countries? Tunisia, for example, I think currently has certain elements. It's second in the world in terms of investment. Therefore, there are big disparities. And countries in Africa that over the decades have prioritized healthcare have been able to respond better, and it shows in terms of the outcome. Our hope was that you see, in a country like Kenya, there's been clamor for healthcare workers have been clamoring for better investment in healthcare for a long period of time. A lot of healthcare workers believe that the public sector is really the only way you can extend universal healthcare coverage. And therefore, we need to invest in these spaces, reduce the brain drain, because for the early part of this century, many Kenyan African doctors, and Kenyan doctors in particular, were moving to Western countries, and we were losing all our doctors to the West. We are also not investing adequately. And so equipment was dilapidated, buildings were, the buildings that were put up by colonial times, those are the buildings we still had. We didn't have equipment, we didn't have supplies. And it's this same tragedy that brought its face forward during the pandemic, where we have healthcare workers expected to work in facilities, but at the same time without the necessary personal protective equipment. And as a result of this, a couple of healthcare workers contracted the COVID-19. Some passed away, and it's because of this that you saw early on last year healthcare workers saying, you know what, it's one thing to fight the pandemic, it's another thing to fight the pandemic without adequate equipment, and that this is what contributed to that at that time.
Peter, I think what Victor has said resonates with you, knowing full well that it cuts across the continent. A lot of times, countries on the continent have actually invested in its own experts to seeing that they stay back, get the best. You are an example. Going through your resume, we've seen how your foundation in Nigeria, but pretty much the UK has spent a lot in, expanding your knowledge. Tell us, if you will, how this, lack of investment in experts like yourself, Victor, and so many others on the continent is affecting what we're discussing today, medical tourism.
Thank you for that question. I think in Africa, we do not really place emphasis on research. So healthcare development is not all about treating patients within the hospitals. Healthcare development starts from the very beginning when you have a student in medical school, or when you have a researcher like myself who also collaborates with the medical school to improve the way people learn and the way for them to understand how to interpret scientific data. So like you earlier mentioned, for me, I started off my career or my academic background in Nigeria, where I did biochemistry to start with. But fast forward, I actually sponsored myself for my master's. Then I came back, applied for a number of scholarships for PhD within Nigeria, and I was not given the opportunity. Despite I wrote the exams, I had the required scores they were looking for. But you know, on the continent, it's when you know someone in high places, you are given the opportunity to do some certain things. So thereby, we end up putting our wrong foot forward, whereas the best of ours are usually left behind. And this best of the best are usually from, let's say, from places where they know no one. So when you have these individuals who are kind of highly skilled, but they lack the connection, that is the word now, they lack the connection to know people in high places, they are left stranded. So in my own case, if I'm to quantify, you can't really quantify it anyway, but if I'm to kind of put a figure to it, when it comes to the monetary value that the University of Aberdeen invested in me, I think my tuition fee alone is beyond £60,000. That is more than 36 million naira in Nigeria. So it's more than, I think £60,000. My research fee as well is a different level entirely. And at the same time, while I was here at the University of Aberdeen, just a chapter of my thesis was sponsored, the last chapter of my thesis, and that was £25,000. I wrote a grant and I was issued that particular fund to do a particular research to understand the level of obesity, diabetes, and body weight gain in people. So you can see that here, we place research at the level of high level of priority. And based on this research high level priority, it enables you to understand how to bring the solutions you need to the pressing needs of the society. So for instance, in Nigeria or many African countries, the research that are conducted within the tertiary institutions, they end up in the shelves, whereas the research we do here are tailored to meet specific needs. So in my own case, we're trying to look for ways to understand how the brain is responsible for controlling vitamin A. And this vitamin A is highly essential in human diet. And in Africa, for instance, you have high level of vitamin A deficiency. You see, we are here trying to do this research for problems that are in Africa. So clearly, I think what we need to do on the continent is to ensure that we infuse research alongside with medical training. And that research arm is lacking in our response. That's why when you look at the level of data that is coming out from Africa, specifically in Nigeria, they are really, really poor. And this level of data cannot really meet international best practices when it comes to publishing them in high impact scientific journals. So when you go to Nature, for instance, when you go to PNAS, when you go to top ranked journals in the world, you barely see research from Nigeria or Africa, apart from South Africa, in this high level of high impact journals factor. So that's where you clearly know that of a truth, we lack the human capacity. We do not take that into cognizance to say, you know what, we need to invest in these individuals. We lack the skills as well. So if I come back to Nigeria, for instance, today, fine, I do have my degree, but I'll be more or less useless like the paper itself because I may not be able to practice effectively because the environment is not conducive enough.
Victor, listening to Peter, and I'm thinking some of the challenges people have to deal with, experts like yourself. You're a medical director in Kenya. Tell us if you've also experienced, some of your best hands leaving your medical facility, to go to the Western countries, or because of some lack, as highlighted by Peter, that hasn't actually been coming from the government.
You know what? Before I became medical director a few years ago, I helped found the Doctors Union in Kenya. I was the first chair for the union, and what drove us to this was simply this. We realized that we were faced with a very difficult situation. Either we leave public service and go into private service sector or go to other countries, or we sit in and say this is what needs to be done. And we made a decision that time as a group of young doctors to say, you know what, the same doctors Europeans are getting from Africa, those same doctors can improve our sector. And I think back in the decade prior to 2011, Kenya had 1,000 doctors to Europe and the Western world. This is something that can be replicated across many African countries. If you go to any developed country today, the number of top doctors, top healthcare workers you're going to find there from Africa is going to amaze you. Kenyan African brains going into the West are some of the best brains that exist in the health sector. The difference is linking these resources, this human capital, to strengthen physical capital and physical resources, infrastructure, equipment, medical supplies, and then good systems that work. And these things are possible, by the way. Doing these things in the public sector across many African countries and retaining this stuff, in Africa could go a long way in strengthening healthcare provision. I think if we just change our thinking a little bit, we may find Africa taking its rightful place in healthcare provision, because nothing the West has that you don't have. There is nothing that can be created elsewhere that can be created in Africa. And we have examples already. There's a lot of private facilities in Africa that are doing amazing work. They've been able to attract doctors from the West back into Africa, from India into Africa. They've been able to put in, high-level equipment. Where I work right now, there are a number of things we are doing that wasn't possible just a few years ago. And therefore, if we understand that all it takes is political goodwill, good leadership, good systems, and some resources, we could change this narrative. But to answer your question directly, yes, we have experienced painful losses of healthcare workers who leave Africa and head to other countries where, already there are resources. It's a place where there's a lot more. And in Africa, where that resource is needed, we keep losing the personnel.
Peter, in the end, it's not about the race. It's about first who we are, humans. Irrespective of where we're from, you stand a chance of standing to be counted amongst the very best. Now, speaking about the African experts, so what is missing is, what we're highlighting now, the resources, the support from the government to help these experts. Now, looking at what is happening in other parts of the world, for instance, in India, which is one of the countries where we have seen a lot of Africans, the political elite, as well as the poor Africans go to for some simple medical procedures. India, before now, wasn't as fantastic as Nigeria, that once upon a time the Saudi royal family came all the way to the University College Hospital in Ibadan, southwest of Nigeria. What went wrong, Peter? If you can help us, dissect that. How did things go this bad?
I kind of like the way you placed the question. Quite frankly, it's not about let's say ethnicity or where you're from. It's about the human race, and the human race is just one race. And when you look at India, for instance, or you want to compare India with Nigeria, I see not much difference between India and Nigeria. It all depends on the perspective you want to look at it from. Again, when it comes to the aspect of what went wrong, I think is a two-way approach. First, we say we're not sincere to ourselves as a people. So when you say the government, who are the government? The government are the people, right? And for instance, if you put me at the helm of affair, let's at the level of, let's say, Minister for Health, and I'm not doing the right thing, that is me not doing the right thing, not the government, because maybe the budget is reduced to me, but because I have a dubious mindset or I'm not really perturbed about what goes on within my particular constituency, I don't really invest or pay much attention into the development of that particular sector. So basically, you'd also have people, so I'll use Nigeria as an example, which may be a kind of a similar example in other African countries, is that you have people who are within the government parastatals, say, for instance, federal medical centers or teaching hospitals. These individuals, they have more than 4, 5, 6 hospitals which are private. So they could literally abandon that of the government and pay more attention to their own personal hospitals or clinic, just for them to attract patients from the government arm to their own end. So this whole idea of kill the government sector so that we can have the profit margin in the private sector. And a classic example again in Nigeria is the current secondary schools, you know very well that the primary schools and secondary schools in Nigeria are not really top-notch any longer compared to when I did my own primary and secondary. Now today, when you go to a normal government public school, is an eyesore. So that particular section of the education system is dead. And that was a strategic move by some greedy, selfish individuals just to have a way to pull those individuals to their own public sector, private sector to harness profit. And again, that is the current move that is going on right now at the level of the tertiary education. You realize that the tertiary education, when it comes to private institutions, are booming in Nigeria. And for instance, there are some schools in Nigeria where for you to earn a medical degree costs you about 5 million naira per year for a tuition fee. So you could see that people are actually trying to, let's say, alter the effort of the government. Of course, they are the government. At the same time, trying to profit their own individual, or let me say, greed. That's why I said it's a function of our own peculiarity as individuals. If we want this thing to work, we need to sit tight and make it work. But because we know that there's the underlying benefit that if this fails, I'm going to benefit from it, then I will look the other way for that to fail. So first and foremost, we need to sit tight and say, you know what, we need to fix this healthcare system. So for instance, not many Nigerians or many Africans have the wherewithal to go for a high level quality care in these private institutions. And based on that, we need to say, because we have people who are humans, because first we are humans before anything else. So you need to put that particular human face on to say, I need to do things right for the sake of humanity. But in this day and time, it is obvious that people are more interested in the profit at the detriment of the human race. That's the point in Africa.
Victor, let's bring you in on this before we go on a break. You know, the continent has had to depend, sadly, on donations from foreign governments, agencies, and private companies. That is indicative of the lack, the gap in the sector. Why do you think, governments across the continent, many governments across the continent still don't see the need to plow, in resources to jumpstart the medical sector?
Well, Suleiman, I think the bigger part has been a lack of recognition of healthcare as a fundamental investment. A lot of people look at it as a sort of its consumption. It's basically the current expenditure, not realizing that a population that is sick cannot produce, a population that is sick cannot work. And therefore, look at all economies across this world, this globe. If any economy that has done well is around healthcare that works. I mean, the people are healthy; they are working healthcare systems. In Africa, we haven't really look at it this way. For those in authority, quite a few of them have found those those opportunities as opportunities to become rich and to have friends who then can supply government and so on. Those who have good intentions haven't realized what it really takes to actually put in good healthcare. There is this perception that just a little bit of primary healthcare is good enough for the ordinary citizen, while in fact, what the ordinary citizen requires is a little bit of high-level care, which is very much possible. And without that understanding, that what we see in the leading private hospitals in Africa today is good enough for the person at the bottom of the pyramid in terms of socioeconomic status in Africa today, and that delivery is possible. Unless we see that, unless we see the role of healthcare in economic prosperity, you may not actually invest in it, because many politicians look at it as something to take away from the budget, not to give in. And to put this in perspective, India, for example, from medical tourism alone, is making almost $6 billion a year from medical tourism. That is, almost as big as some budgets for some African countries. For Kenya, for instance, it's almost 25% of our annual government budget. And if we understood that from investing in healthcare, healthcare will not only reduce our losses in terms of sick days, will improve our productivity, but also earn us revenue as a nation or as a continent, we will miss out on the opportunities that exist. Right now, Africa is dependent on the West to give us vaccines. Why should that be? you'll go to every vaccinating, every organization that has come up with a vaccine, you'll find brilliant Africans at the forefront of that. Any development in healthcare, you'll find brilliant Africans at the forefront of that. Because what these nations have understood is that these brilliant minds ought to be put in places that they can produce solutions for the African. In so doing, there are lots of resources that accrue to these countries. Can't we just shift our thinking a little bit? Understand that healthcare is critical to development of the African continent, but healthcare is critical to our prosperity as a people. And if we understand it as such, can we invest in it first? Because if we invest in healthcare, then we can get our people healthy, and healthy people can work, can produce, and we cease to be dependent. I saw very recently, just here in Kenya, we were having a situation where more than 80% of our ARVs, antiretroviral drugs for HIV, are being donated. And if the donors pull out, basically the whole system crumbles. We shouldn't live like that, not in 2021. We should be solution providers. Let us begin to provide solutions for the African people.
Well, it's a conversation that we must stay on here on the square. We'll take a moment while we'll come back. We'll explore this much more as we get pretty much more from Victor and Peter. Join us again. Well, if you just joined us, you're welcome. You're watching Village Square Africa here on News Central Television, and I have with me as company Dr. Victor Ngani and Dr. Peter Imoisi, both Africans looking at the problem of medical tourism on the continent. Clearly, South Africa stands out on the continent, as highlighted by both of them in the area of investment in its healthcare sector. Now, this can be confirmed through its regular medical tourists, more than 80%, yes, of whom come from other African countries. Now, hit the West, affected the most, South Africa has had the best response to COVID-19. Also, as highlighted by both Victor and Peter, successfully reducing the virulence of the most transmissible strain of the virus. Now, good to know both of you are still there. Let me come to you, Peter, quickly here. We're trying to look at solutions. You know, it's like an average human being. We all love quality things. We love the good life. So, you know, it's a shame that those who go outside the continent have actually witnessed how it is done elsewhere. The most shocking thing is that when they come back home, these political leaders don't replicate what they have seen outside the continent. Take us, you know, through some of the processes we should be putting in place, or what we should be looking at doing now. Now we're talking about solutions now in an age of physical distancing and lesser physical meetings. How can we start first by putting in place the small little things here on the continent before we start looking at those big things, just the way it is in Aberdeen and elsewhere in the world?
That's quite a very interesting. So for me, if I taste a bottle of honey and it's so sweet, why will I tell you where I got it from? So I think that's so I think that is the ideology of African leaders. So I go out there, get the best, then come back home and flaunt it on your face and tell you, you know what, I just got back from the UK. So, you know, that's the thing. To be more serious here, I think what we need to do clearly is really simple. First, we need to ensure that if you are elected into the corridors of power, you need to also participate, or you need to use the same facility for which the people who voted you into office are also opportune to use as well. Now, also, we need to ensure that we remove those privileges that allows our leaders to go out of the continent to seek for better care. So, for instance, if I know that I have no options at my disposal, then I would definitely fix what I have within my space. But so long that we are aware that there is opportunity for us to go out to seek for medical care or whatever stuff we go for outside of the shores of Africa, then we will not be serious, basically. So that is the one. So first, the political elite need to say, once you are elected into office, you are not allowed to go out of the shores of Africa for any form of medical care. Then secondly, on the continent, for instance, country by country, we need to also ensure that we do retraining of our experts. So it's not enough to say Africans are the best in the world. You can only be the best in the world once you have the right tools to work with. So you may be so intelligent, but if you don't have the right tools to work with, then of what use is your intelligence, for instance? So first, you need to fix your infrastructure. Now, after that, you need to ensure that you have the right set of people with the right set of mindsets to train these youngsters. So, for instance, when you have people in place of authority, say for lecturing, for instance, who are not so tuned into their career or what they are meant to be doing, then you have this issue of people who come out from the university, and we refer to those individuals as half-baked. When you say half-baked, it's not a function of just the student, it's a function of the system, both the individuals responsible to train these people and the people themselves as well. So we need to look into that area as well and say we need to revamp the educational system. So I'll give you an example. About 2 weeks ago, I had the opportunity to teach first-year medical students here on how to effectively do research. So they are in medical school, quite correct, but they have a module they do engage in for 1 month where they are paired with experts in research. And what we're hoping to achieve is to teach them outside of your medical degree, you need to understand how to conduct standard research. And that knowledge is very vital when you want to actually fight a pandemic. And that same knowledge is lacking in our own system. So we need to ensure that we infuse the medical degree training alongside with research. Then here in Aberdeen, for instance, there's something you have where you have a 1 year, it's called it's a calculated degree, where you take 1 year off your medical degree and do a biomedical degree for 1 year. And in that 1 year, you're also exposed to research, a bench-based research in the laboratory. So what we are trying to help you to understand is to tell you that outside the normal human health medical degree you're trying to go for, you need to understand how you come from the bench to the bed. So for every drug you have today, it actually started off from a laboratory. And based on that particular experience, these clinicians are able to diagnose, attend to people, and provide solution in a sound and reliable manner. And as a result, you have the issues of misdiagnosis being eradicated completely, which is common in Africa.
You know, Victor, you know, what excites me here is, you know, seeing that I'm having conversation with fellow Africans, and I have a robust, you know, discussion with fellow Africans and fill in the gap. So what this tells us is that we have the experts, and listening to both of you, we can actually replicate and start to, you know, take up the very young and bring them up to become experts or even better than yourselves. Now, let's start looking at how we can do some of the things as highlighted by Peter. Where the government needs to come in, you let us in on that. Where the people or experts like yourself need to, you know, dig deep and dig in, then you let us in. Tell us how we can go about this on the continent.
Well, thank you very much, Suleiman. And indeed, Peter has been right on the money, a couple of things. I think this cuts across many nations in Africa. Let's make this rule that if you're in government, then you have to seek healthcare in government facilities. I think that's a good starting point. If you are stuck to government facilities, you'll make those facilities work. And if you have the option of going to the US on taxpayers' money, you'll go to the US for a cough, and that's exactly what happens. The part I'll differ with Peter slightly is we do have people capable of research in Africa. In Kenya, for example, there's a Kenya Medical Research Institute, which has been critical in the development of multiple vaccines in this world. I mean, Oxford University, AstraZeneca, the whole team, malaria vaccines, HIV, lots of research being done. The problem is this: we as Kenyans don't put any money into it. These studies are funded by external parties, and as a result, then they own all those studies. Yet the actual work is being done by Kenyans and by Africans within Cambridge. So can we change that a little bit? If you look at the example of Peter, right now he's a research fellow in Aberdeen, Scotland, teaching European students how to carry out research. Tells you one, that Peter is an expert, that's number one, given he's African. Number two, if he can teach a European student, we are the human race, you can teach an African student. You may even get them to be better. So that's the next thing. Can we make it possible for Peter to come from Scotland back to Nigeria, get the tools he needs, get the people he needs, and the resources needed to make this work meaningful and productive? And this can be done. But it also has to be leadership. And I've said before, not in this show, but elsewhere, that what we need in healthcare are PIVA leaders. PIVA, P for passion. You have to have a passion for the people, for what you're doing, to make healthcare better. I for integrity. Because what ails many African countries is corruption. Someone looks at a chance, instead of building healthcare for a community, you look at it as a chance to buy a big car and some other really poor ways of looking at life. The next thing is vision. You have to have a vision for healthcare, a vision that works, to believe that it's possible for the public sector to function better than the private sector. You know, to have the ability, that's the final word, the A, ability to make this happen. You know, it sounds utopian and out there, but look at South Africa, for example. Because of years of investment, people are leaving the United States to come for treatment in Africa because it's cheaper, it's better, it's good quality. People are leaving Europe to come to SA. You know, it shows us that it's possible to build something in Africa, not because we are black or because we are Africans, but because they are human beings in this space and be able to make this matter. And therefore, I do agree. Let us just change our minds a little bit. Let's put in people of ability and passion and integrity and vision in those spaces of leadership, and let's see what we can do in Africa. Then let's make it possible for the experts who are out there to come and do the same good work they're doing out there in Africa. And fully, as Peter said, let us have the resources that make this meaningful. It's difficult to, bring a neurosurgeon from the UK who's doing robotic surgery. Is Kenyan, but I mean, you come to Kenya and there's nothing he can do. I mean, he doesn't have a simple theater, doesn't have a single item to work with. There are no people being trained, and therefore his intelligence is not being put to good use. We can actually link that potential to the resources and do better for our continent in this lifetime, if I may add.
Well, I like the acronym you just gave to us, but again, if you look at it, that is why both of you are here. You have the passion for the continent and for humans, and that is why it is easy for you to get out and have 1 hour of your precious time to speak to Africans and the world on how best we can make the continent better. Peter, talking about some of the key things he raised, he talks about corruption, public sector corruption. You also highlighted that much in your conversation earlier on. How can, yes, I know you're medical experts, you're a researcher, but again, you should have an idea of how we can stop some of these things. You said one of it already, be in line with us, use the same hospital, the same facility, and if that is something that can be put in the Constitution for any elected or public officer, the key thing for them to do is to fix those, sectors, knowing full well that they also will be making use of such sectors. That is on the one hand. But again, is that something that the lawmakers, now we're talking about the legislature, the legislative arms of African countries, how can we, lobby these people to ensuring that such is made a law in many African countries?
Thank you for that particular brilliant question. And thank you, Victor. So, the reason why you have African leaders leaving the shores of Africa to other parts of the world for their medical care is because there's no element of trust on the people you have in several places when it comes to healthcare. And they are so very much aware of this, basically. So, for instance, if I bring in my brother, who I know very well is not really good in a particular field, but because we are related, I make him the MD or the chief medical director of a particular hospital. Now, because I know what I did, I'm not going to put my life on the line for my brother to treat, because I know already my brother is not competent. So clearly that is corruption as well. So bringing in the wrong persons in the right position is corruption as well. So first, we need to also ensure that we bring in the right experts with the right set of skills for that particular role you're trying to recruit for. So that is one. So once you're able to bridge that gap of trust, you also have your leaders actually adhering to the rules laid down by themselves to have themselves treated in Africa. I'll give you another example. So here at the University of Aberdeen, we do have a number of African students, both from Kenya, Nigerians. They make the bulk of the numbers. And the recent tuition fee I checked for these individuals is somewhere around £21,000. That is really a lot, about, I think, let's say 17 million or thereabouts, based on today's exchange rate. Now, do you know that these Nigerians as well, most of them, I do train them in their undergraduate research degree. So here is a Nigeria from Nigeria training you, and you're paying so much for it. So of a truth, are we not hypocrites? You're saying that you don't like Nigerians, right? But you're coming down to this area. In fact, in engineering here at the University of Aberdeen, we have a number of Nigerian professors. When I mean a number, more than a handful of Nigerian professors in engineering. And you have chunk numbers of Africans, Nigerians as well, who are actually in these engineering courses. So clearly you could see that when it comes to sincerity, number one, we're not sincere with ourselves, because if we are, for instance, we'll bring in the right set of individuals to man these positions. So we need to first and foremost look for the right individuals, put them in the right place of authority, and secondly, create the enabling environment. So what governments could do is really simple. Your role is to create the enabling environment. Now, after the enabling environment is created, you then have the faith in the individual in that particular position to do what is right. But the question is, how many Africans are actually willing to do what is right? I see this as a kind of class thing. So if I'm able to go to the US for my medical care, I see it as a kind of a class. I'm better than you. But once we are able to do these things within the continent, putting the right set of individuals in the right positions, then we can say of a truth, I can lay my life on the bed, knowing fully well that whoever is going to look after me is the best of the best. For instance, when Boris Johnson, the Prime Minister of the UK, caught COVID, for instance, he was literally treated in the same hospital like every other normal individual here in the UK. But here you are, my own beloved country, the number one citizen of the country is right here, using the same NHS. So NHS is a public health services. It's public. It's not private. It's public. So if you could come to a public, well-standard public institution to say, this is where I want my medical care, how much more you also fixing your own public institutions in the continent? So first, train your experts to the very best of the best. Put in the right set of individuals at the right place and positions. Ensure that these particular individuals have a vision of 10 years. So in 10 years, this and this and this is what we intend to achieve. Now, after that, you do a regular KPI, key performance indicator assessment. If this particular targets are not met, these individuals should be kicked out of the office immediately. Now, when you see the level of seriousness from the government, then the individual themselves will sit tight, because there is no government without individuals, and there's no individuals without government as well.
Victor, you want to react to some of the things highlighted by Peter there?
No, Peter is absolutely right. I think we all ought to be quite distressed and a little bit, not just at the leadership level, but at the citizenry level, to have to say that we are leaving our countries to go to another country because basic care is unavailable. And it's worse when you're in the leadership area, because then there's a little bit more that you're called to. Perhaps it's important if something is really lacking, then it's fine, go to those countries. But when you come back, your first port of call should be to the Ministry of Health and ensure that those services are now available within your country. But I'll move this conversation further to the citizens and ask, one of the reasons why leaders get away with not investing in healthcare is because we as the citizenry don't demand better healthcare. It's as simple. So you have a situation where, for example, in an African country, Kenya will be once again very precise, where someone would, in the term, as in some senior government position, they reduce the budget for healthcare by a big chunk, and then later on in life when they run for presidency, then the people vote for them. And, that kind of disregard for the record towards healthcare contributes to a continuation of poor healthcare in terms of service provision. If healthcare wasn't a provision at a low level, it cannot be a provision at a high level. And the same cuts across every level of elected posts, whether it's a member of parliament, whether it's a councillor, whoever it is. We ought to begin to ask these leaders, what is your healthcare agenda? What is your healthcare record? Don't just tell me what you're going to do, show me what you have done. And if that person is running for office and they've never done anything for healthcare in their history, ladies and gentlemen, let us wisen up and say, this person is not good for me. This is a person who will cost you everything. In Kenya today, we have COVID-19. The cost of care for an ICU bed is about $1,000 per night, $1,000 US per day. And this is an expense that you could avoid if we had leaders who would invest in healthcare. And goodness, we had a whole year. We hadn't invested for decades, but then COVID happened. We saw what was happening in Italy. We saw what was happening in the West. And we had a whole year to invest in healthcare, and we didn't do it. Now we are in the middle of a wave, and you're acting surprised. And you know what? As a country, we've put in about $6 billion in debt that we've accrued over this COVID-19 business. Yet capacity hasn't increased by more than 3 or 5 or 4%. We can change this narrative. It starts with you and I to begin to hold our leaders accountable. Peter was saying if a leader doesn't act, he should be kicked out. I agree fully, but I'm putting that onus of kicking them out upon the citizen. Let us get into the habit of saying, if you've not delivered for healthcare, my friend, the standard has been raised, the bar has been raised. We, as a people of Africa, have raised the bar. If you're not going to do something for healthcare, please ship out, because times have changed, the years have changed.
Gentlemen, a healthy nation is a wealthy nation. Do you think the continent will get to that point where many countries, just as we've seen in South Africa, will start to experience medical tourism, coming to the continent? Peter?
If you are to gauge this by the level of the attitude, let's say, let me use my own country, Nigeria, for instance, I don't see that clearly. Like Victor earlier highlighted, that COVID gave us the opportunity to kind of sit tight and do things right. So in the first few weeks of COVID, I was like, it's like we're going to do things right now. But as we went along, I kind of see that we're not really doing the right things that we should be doing, basically. Like he also said, there is so much money into COVID now, but yet the level of capacity development is not in collaboration with the level of money that is coming in, which is strange. And again, you could say, in the middle of a pandemic, people may likely not be doing the right thing, or they may be cutting costs, trying to kind of take the money away as there's nothing going on. So clearly, what we could do going forward is really simple. So we need to ensure that we put research at the center of what we're doing. For instance, in Africa, what are the major health challenges? Number one is malaria. It's malaria that is number one on the list. After that, you have the child maternal deaths. Then at the same time, you have cholera in some few places. You have typhoid. Those are just the normal tropical diseases that is common within Africa. And these sort of diseases can actually be treated at the level of the primary health care. So again, that comes down to the local government authorities to fix the primary health care. Then you have the secondary health care as well, where you, the federal medical centers and what have you, where you could attend to some specialized cases. Then you then have the tertiary healthcare system. But what we see in Nigeria or in many African countries is that the primary healthcare is in shambles completely. That is completely eroded. And most times, all through my stay in Nigeria, I never went to any government-owned hospitals. I went for a private-owned hospital, basically, because where I was, the primary healthcare system, when you go in there, there are no doctors on ground. And if there are doctors on ground, there are no equipment, there's nothing to diagnose what is wrong with you. They just do verbal diagnosis and say, what is wrong with you? How do you feel? This and that. And they write all sorts of drugs for you without clearly checking what exactly is wrong with you as an individual. So we need to fix that level of the primary healthcare system. And once that level is addressed completely, you have a sound and whole society who will be really strong enough to bring in the required economic growth you're looking for. So for instance, here in the UK, for instance, the first point of call is to see your GP. Is when whatever you're trying to see the GP for is beyond that particular level, you go up to the level of the teaching hospital where you administer the required treatments you need. So I don't really see Africa in the next 5 or 10 years being able to get out from the wood and become the next destination for medical tourism and what have you. I don't really see that because the indicators that we see now are not really tending towards that particular direction.
Let me close with Victor and see if Victor can actually see the horizon, see a better future. Do you see anything different from Peter, Victor?
I see a brilliant future for Africa. I know our past has let us down healthcare-wise, but the very fact, Suleiman, that you have in this convention today is evidence that there is hope. And I want to cling to that hope. Because I know at this juncture, there are many Africans across this continent listening to me and listening to Peter, listening to you, and they know that we can do things differently. It starts with you and I, that we wake up and decide to hold our leaders to account. Let us stop voting for the leaders based on tribe and based on how much I know them. And start voting for the leader because of what promise he holds for my people. Let us begin to shun corruption in public sector. Let us begin to do things the right way. And if we do that, then within 5 years as a continent, I believe we can do better and we can do different. I'll give the example of Kenya where, unfortunately, very unfortunately, a member of parliament passed away in the rural county. And we expected that as a result of this, there'll be an awakening and the members of parliament would say, okay, let us build grassroots structures. But their solution, it's publicized, you can look it up, was to allow for members of parliament to have helicopters evacuate them. Is that kind of thinking we need to throw out and introduce new thinking that says what you see in the West is possible in Africa. If it's good enough for anybody else on this planet, as a human race, it's good enough for the lowest of the African. The NHS works in the UK. It can work in Nigeria. It can work in Kenya. It can work in every single African country. All it requires is the understanding that this investment is a real investment in the people. If any government said, I value my people, and doesn't invest in healthcare, that government does not value. And we as the electorate need to be wiser to begin to make good decisions. But I do have a good feeling about Africa's future because there's a young generation that's waking up. There are many, many people who are keen now and listening to these conversations. And I believe we'll begin to make wiser decisions going forward.
Well, it's a fine place for us to put it. You know, Africa must rise. That's what I get from both of you through its challenges and compete with the rest of the world as medical tourism increases in value by the day. It is a route to economic prosperity, and everything except the will to succeed is present in Africa. And that is why you both have said we should start looking at electing the right leaders. So it's left to those who pilot the affairs of the continent to lead the charge, else the people will take the lead and put the right people there. Many thanks for being such nice company, Doctors Victor Ngani and Peter Imoisi. It's always nice to have you around on the square. And to you, my viewer, I'll see you tomorrow. Bye-bye.